Hello, my name is Shannon Turner. I'm the Executive Director of the Public Health Association of British Columbia and the Chair of the WHO Vaccine Safety Net. I wanted to share a couple of comments about my enthusiasm for the Infodemiology Conference and the experience of partnering and participating in the sprints. I thought the conference was brilliantly designed, that we could undertake this globally at a time when it's so important for us to be connected, and that we could learn from each other in so many ways, the nuances and insights provided by various different fields. My background is health informatics and public health, and as such, I've been keen to engage in a larger discourse about what we can learn and what we can harvest from the Web 2.0 and the various different channels that are available to us there for one-to-one and many-to-many conversations. This conference really helped to highlight the significant challenges ahead with respect to our role, the appropriateness of monitoring and surveillance, the way that we protect public health and the evidence base for good public health practice, helped to highlight the importance of communication, collective identity, individual identity, and the way that we interact with information technology and the types of solutions that support decision-making. I was very impressed with the WHO's ability to pull together this conference during a time of unprecedented public health challenge. I want to congratulate the organizing committee for your service to us all and to the greater good. It was brilliantly done, and the caliber and quality of the conversations, discussions, and the questions and the design really served to target and focus our outcomes. I think the thing I was most excited about was the hopefulness of our encounters, that there's so much of a shared agenda across disciplines in our keen interest to better understand this digital ecology and how we can ensure that it works in service to humanity. I think that the focus on the diffusion of information, social intelligence, what we need to do to listen online, all of those aspects were brought to bear in our conversations. We're also concerned about how infodemiology is developed over time. And I can speak from the health information science perspective that we've been involved with this conversation for many, many years, examining the capacities and features of systems, the appropriateness of technology, the degree of user adoption, the success of innovation, the appropriateness of technology in different cultural settings. Each one of those aspects of information systems management and design have relevance to this conversation. More importantly, I think, was the cautionary note about ensuring that when we build our response to the pandemic and as we examine the potential for infodemiology as a science, we don't limit ourselves to addressing the negative, but rather focus on successful models, what works, the health promoting orientation and capacity that is available to us. The other part of this that I found very important was the stress on vulnerable populations, our concern about not increasing inequalities globally, how we manage the sharing of information across the globe so that we further enfranchise citizenry and operate consistent with the goals of this Sustainable Development Goals. All in all, it was an outstanding experience. The contributions were so worthwhile. I see many potential collaborations ahead, and I am profoundly grateful to have been part of this groundbreaking discussion, and I look forward to the work we're going to accomplish together moving forward. Many thanks.